7 more people were hospitalized in Spokane County today with COVID-19. That's not the only thing keeping hospitals busy. More people are outdoors this summer, and that means more traumas to deal with. It's burning out nurses when they're already in short supply. Rania Kaur is here with how the nationwide shortage affects us here at home.
It's not new, but with everything that's happened in the past year, it's definitely different for nurses providing care. Many of them have had enough. A year dominated by the pandemic, the demand on healthcare workers is higher than ever. At Sacred Heart Hospital, Chief Medical Officer Dr. Dan Getz says he's seeing the effects on doctors and nurses.
We, as you mentioned, are not just seeing high levels of COVID, we're seeing high levels of all kinds of illness throughout the community. We're in trauma season right now. That's what happens in the summer, and people are tired.
These shortages aren't new, but nurse Alyssa Bolt says these days with everything that's happened, it's harder.
I will say that lately the morale feels different from other shortages. I think there's a big feeling of just burnout right now in nurses.
On her floor, they've had to operate short staff for a while now. On days with more nurses, they're sharing the load on other floors.
It's hard to get up in the morning and know that you might be facing a high workload that may put your license at risk or make you feel when you go home at the end of the day like you weren't able to give the care that you want to provide.
They're trying to prepare for this at the Wazoo College of Nursing. Director of the bachelor's program, Dr. Wendy Williams-Gilbert, says they're seeing enough interest in students. It just takes a little more to get them to patients.
We're working from all the top levels of legislature right now to make sure we can get nursing funding, we can get clinical placements, and that we can get good quality nurses out to you.
Trying to fill a desperate need as quickly as they can. Bolt says they don't tell patients they have staffing issues, nor do they want patients to worry about their level of care, because if people need to go to a hospital, she'd rather them not delay and make things worse because of staffing issues. Reporting in studio tonight, I'm Rania Kaur, 4 News Now.